Explain the importance of adhering to vaccination schedules for both core and non-core vaccines in veterinary medicine. What are the risks involved if vaccines are administered prematurely or delayed? Support your answer with guidelines from the American Animal Hospital Association (AHA). Answer: vaccination schedules are essential in veterinary practice to ensure the proper immunity against infectious diseases, both core and non-core. Core vaccines are those that are recommended for all pets regardless of lifestyle, e.g. rabies, distemper, parvovirus, while non-core vaccines are given based on the animal's lifestyle and geographic location, e.g. leptospirosis, Lyme disease. Premature vaccination can lead to the failure of the immune system to respond appropriately, especially in puppies and kittens whose immune systems are still developing. Vaccinating too early may also interfere with passive immunity derived from colostrum. Delayed vaccination can leave the animal vulnerable to disease, particularly if they are in high-risk environments or are exposed to communicable infections. The AAHA guidelines emphasize adhering to age-appropriate vaccination schedules and performing serological testing if there's uncertainty about immunity. Vaccination is also critical in the context of herd immunity. If one animal is unvaccinated, it risks not only its own health but that of others in the community. Describe the impact of failing to implement a comprehensive parasite control program for a dog living in an area endemic to heartworm. Include the consequences of untreated heartworm infections on the dog's health and the treatment options available. Answer: failing to implement a comprehensive parasite control program in a dog living in a heartworm endemic area significantly increases the risk of the dog contracting heartworm disease. Heartworm disease is caused by Dirofilaria mythis, transmitted by mosquitoes, and affects the heart and pulmonary arteries, causing inflammation, heart failure, and organ damage. Consequences of untreated heartworm disease: severe lung damage and pneumonia, congestive heart failure, and possible death due to heartworms obstructing blood flow, permanent damage to the heart and blood vessels, leading to a reduced quality of life. Treatment options include a series of injections, e.g. melasmine, to kill adult heartworms, followed by a strict exercise restriction period to allow the dog's body to process and eliminate the dead worms. Preventive treatment with monthly medications, e.g. ivermectin, milbemycin, is critical to avoid infection in the first place. The American Heartworm Society provides specific guidelines on prevention, diagnostics, and treatment protocols. Regular testing, especially in endemic areas, is advised to monitor heartworm status. Mrs. Thompson brings in her 6-year-old cat, Bella, for a routine wellness checkup. Upon examination, the veterinarian notices moderate tartar buildup and slight gingivitis. Mrs. Thompson asks if this is something to be concerned about, as Bella does not show any signs of pain or difficulty eating. What steps should the veterinary technician take to address this concern, and what recommendations should be provided to Mrs. Thompson for Bella's dental health? Answer: the veterinary technician should first inform Mrs. Thompson that dental disease is very common in cats, and even subtle signs like tartar buildup and gingivitis can lead to more serious problems if left untreated. Early intervention is crucial to prevent progression to periodontal disease, which can cause tooth loss and systemic health issues, including heart and kidney disease. The technician should explain that dental disease in cats is often silent in the early stages, as many cats will not show signs of pain until the disease has progressed. The next step is performing a dental cleaning under anesthesia, which includes scaling and polishing to remove tartar and plaque. The technician should recommend regular at-home dental care practices such as brushing Bella's teeth with veterinary-approved toothpaste, providing dental treats and chews designed to help reduce tartar buildup, scheduling regular professional cleanings, usually annually or as advised based on Bella's risk. Describe the role of PCR, polymerase chain reaction, testing in diagnosing infectious diseases in veterinary practice. How does PCR differ from traditional culture techniques, and what are its advantages in rapid diagnostics? Answer: PCR testing is a highly sensitive and specific diagnostic technique used to detect genetic material from pathogens such as bacteria, viruses, or fungi in a patient sample. The main advantages of PCR over traditional culture techniques include sensitivity. PCR can detect pathogens even in low quantities, whereas traditional cultures may not detect infections in the early stages when pathogens are present in very low numbers. Speed. PCR results can be obtained much faster than cultures, which may take several days to grow. Specificity. PCR can identify the exact strain of the pathogen, which is crucial for guiding treatment, particularly for viruses and antibiotic-resistant bacteria. Traditional culture techniques involve growing the pathogen on media, which can take several days to weeks. PCR, by contrast, can provide a definitive diagnosis within hours and is valuable in detecting infections that are difficult to culture, such as canine distemper virus or feline leukemia virus. Explain how regular wellness exams in dogs contribute to early disease detection and long-term health maintenance. What are some key components of a comprehensive wellness exam, and why is it essential for geriatric patients? Answer: regular wellness exams are vital in maintaining long-term health and catching potential issues before they become severe. For dogs, these exams help detect signs of underlying health problems that owners might miss due to subtle symptoms. Key components of a comprehensive wellness exam include physical examination, checking vital signs, palpating organs, assessing skin, coat, and mucous membranes for abnormalities, laboratory tests, blood work, complete blood count, liver kidney function tests, urine analysis, and fecal exams to screen for internal parasites, vaccination and parasite control status, ensuring that the pet is up to date on vaccinations or preventive medications, weight and body condition score, monitoring for obesity or malnutrition. For geriatric patients, wellness exams become even more critical as pets age. The risk of chronic diseases, arthritis, kidney disease, heart disease, diabetes increases. Regular exams enable early detection and intervention, which can improve the quality of life and prolong longevity. What are the key laboratory tests used to monitor kidney function in dogs, and why is early detection of kidney disease important? Discuss the role of BUN, blood urea nitrogen, and creatinine in kidney function assessment. Answer: the key laboratory tests used to monitor kidney function include blood urea nitrogen, BUN, creatinine, and urinalysis. These tests help assess the kidney's ability to filter waste and maintain fluid balance. BUN is a waste product formed from the breakdown of proteins. Elevated levels can indicate kidney dysfunction, dehydration, or a high-protein diet. Creatinine is a byproduct of muscle metabolism and is more specifically associated with kidney filtration. An increase in creatinine levels is often an early indicator of kidney disease. Urinalysis checks the concentration of urine. In early stages of kidney disease, urine concentration ability diminishes, which is detected in urinalysis. Early detection is critical because chronic kidney disease (CKD) is progressive and irreversible. Monitoring these parameters allows for early intervention with dietary changes, medication, and fluid therapy, which can help slow the progression of the disease. Discuss the zoonotic potential of Lyme disease in veterinary practice. How should veterinary technicians educate pet owners about the risks and prevention strategies associated with tick-borne diseases? Answer: Lyme disease, caused by the bacterium Borrelia burgdorferi, is a significant zoonotic disease that can be transmitted to humans through ticks. In veterinary practice, it is important to recognize the potential for transmission and educate pet owners about preventive measures. Veterinary technicians should explain the symptoms of Lyme disease in pets, such as fever, lethargy, joint pain, and lameness. Advise on the use of tick preventatives, such as topical treatments, oral medications, and tick collars. Recommend routine tick checks after outdoor activities in tick-endemic areas. Educate on the importance of vaccinating pets in endemic areas to reduce the risk of Lyme disease. Remind owners to seek prompt veterinary care if they suspect their pet may have been exposed. Zoonotic transmission occurs when ticks infected with Borrelia bite humans, so technicians should ensure pet owners understand that while treatment is available for infected pets, preventing tick exposure is key to avoiding both human and animal infection. Explain how the process of inflammation can lead to tissue damage if left uncontrolled. Include the cellular mechanisms involved and how chronic inflammation is associated with conditions like arthritis. Answer: inflammation is a complex biological response to injury, infection, or harmful stimuli. While acute inflammation is protective, chronic inflammation can cause tissue damage and lead to conditions like arthritis. Acute inflammation involves the activation of immune cells, e.g. neutrophils, macrophages, the release of pro-inflammatory cytokines, e.g. IL-1, TNF-alpha, and increased blood flow to the affected area. Chronic inflammation occurs when the immune response persists beyond the initial injury, leading to tissue remodeling, fibrosis, and cellular damage. In the case of arthritis, chronic inflammation in the joints can lead to the degradation of cartilage, bone loss, and painful movement. The immune system's prolonged attack on the synovium joint lining results in the formation of pannus, a mass of tissue that can further damage the joint. What is the role of a necropsy in veterinary medicine, and how does it differ from an autopsy in human medicine? What key considerations should be taken when performing a necropsy on a suspected case of rabies? Answer: a necropsy is the post-mortem examination of an animal, similar to an autopsy in humans. The primary purpose is to determine the cause of death, identify disease processes, and gather information for further research or epidemiological tracking. In the case of suspected rabies, a veterinary necropsy involves avoiding direct exposure to saliva or nervous tissue, as rabies is a zoonotic disease, collecting brain tissue for rabies testing, as rabies affects the central nervous system, preserving the brain for direct fluorescent antibody DFA testing, which is the gold standard for diagnosing rabies. The procedure is also essential for public health and epidemiological data, especially in areas where rabies is prevalent. Explain how chronic inflammation can lead to the development of neoplastic processes in tissues. Provide examples of cancers that may be associated with prolonged inflammation. Answer: chronic inflammation creates an environment conducive to cellular mutations and tumor formation. Pro-inflammatory cytokines, growth factors, and free radicals produced during inflammation can promote cellular proliferation and inhibit apoptosis, leading to the accumulation of genetic mutations. Examples of cancers associated with chronic inflammation include colorectal cancer. Long-term inflammatory bowel disease (IBD) can increase the risk of colon cancer, hepatocellular carcinoma, chronic hepatitis, and liver cirrhosis caused by persistent viral infection e.g. hepatitis B and C can lead to liver cancer. Understanding the link between chronic inflammation and cancer development is important for early intervention and monitoring at-risk patients. Discuss the ethical obligations of a veterinary technician when faced with a client who demands unnecessary treatment for their animal despite the technician knowing that the treatment is not beneficial. What guidelines should the technician follow to maintain professional ethics? Answer: veterinary technicians are ethically bound to prioritize animal welfare and adhere to the principle of beneficence, ensuring that their actions contribute positively to the well-being of animals. When confronted with a situation where a client insists on unnecessary treatments, the technician should respect the veterinary medical ethics guidelines, which emphasize non-maleficence, do no harm, and beneficence, doing good. Educate the client on the animal's condition and the potential harm of unnecessary treatments. Maintain client confidentiality while still advocating for the animal's best interests. However, if the client insists on actions that could harm the animal, the technician should refer to their supervisor or senior veterinarian for advice. According to the American Veterinary Medical Association (EVMA) guidelines, if the situation escalates, the technician may need to formally document the case, consult with other team members, and even consider reporting the situation if harm to the animal seems like it. What are the primary ethical principles that guide veterinary professionals when making decisions regarding animal euthanasia, and how do animal welfare laws influence these decisions? Answer: in veterinary practice, ethical principles guiding euthanasia decisions include autonomy. This principle allows clients to make decisions regarding their pet's end-of-life care, but the veterinarian and veterinary technician must ensure that the decision is made based on a sound understanding of the animal's suffering and prognosis. Beneficence and non-maleficence. The technician should strive to alleviate suffering and avoid inflicting unnecessary pain. This is directly connected to the Animal Welfare Act, which protects animals from unnecessary suffering. The AVMA guidelines on euthanasia provide a framework emphasizing that euthanasia should be performed humanely using methods that minimize pain and distress. Ethical considerations include the veterinarian's responsibility to provide the client with information, including alternative options such as palliative care, and advising on the most humane course of action. Laws like the Animal Welfare Act enforce humane treatment, requiring proper justification for euthanasia decisions, especially in shelters and veterinary settings. What is the importance of client confidentiality in veterinary practice, and what actions should a veterinary technician take if they overhear confidential information being disclosed inappropriately in a public setting? Answer: client confidentiality is a cornerstone of professional conduct and trust in veterinary medicine. The Veterinary Technician Code of Ethics and laws like the Health Insurance Portability and Accountability Act (HIPAA) and State Veterinary Practice Acts mandate that client information must remain confidential, protecting the privacy of both clients and their animals. If a veterinary technician overhears confidential information being disclosed inappropriately, the technician should immediately remind the individual involved about the importance of maintaining confidentiality, adhering to legal standards. The technician should then document the situation and report it to their supervisor or clinic manager for further action, ensuring that any breach of confidentiality is appropriately addressed. If necessary, the technician may have to assist in implementing corrective actions or retraining regarding confidentiality procedures within the clinic. Dr. Stevens is a veterinary technician in a busy clinic. One day, a client insists on seeing their pet's medical records, even though the veterinarian is out of the office and the records contain sensitive information about the pet's health. What should Dr. Stevens do in this situation? Answer: Dr. Stevens should carefully follow the clinic's policy and relevant laws governing client access to medical records. Since the veterinarian is not available, Dr. Stevens should explain the situation to the client, informing them that the veterinarian is unavailable and that the records can only be released when the veterinarian is present. Offer an alternative, such as scheduling a time for the client to return or contact the veterinarian directly for the release of the records. Dr. Stevens must ensure that the release of any medical records follows the Health Insurance Portability and Accountability Act (HIPAA) guidelines, as well as the clinic's confidentiality policies. If the client insists, Dr. Stevens should consult with a supervisor or senior veterinarian before proceeding to ensure that the release of information complies with legal and ethical standards. What is the role of a veterinary technician in the collaborative decision-making process, particularly in complex medical cases? How should a veterinary technician contribute to the team? Answer: veterinary technicians are integral members of the veterinary team and contribute significantly to decision-making in medical cases. Their role includes providing accurate assessments and information regarding the animal's condition, gathered through diagnostic tests, observations, and client history, educating clients on treatment options and helping them understand the veterinary team's recommendations, ensuring they make informed decisions. Veterinary technicians also assist in formulating treatment plans, particularly in areas like anesthesia, emergency care, and post-operative monitoring. According to the veterinary nurse role framework, technicians should act within their scope of practice, provide their expertise in clinical procedures, and ensure clear communication between the veterinarian and other team members. Technicians should advocate for the best interests of the animal, ensuring all options are considered and that the client is fully informed of the potential outcomes. Why is lifelong learning essential in veterinary practice, and how do professional organizations support this process? Answer: lifelong learning is essential in veterinary practice to keep up with advancements in medicine, technology, and treatment options. It ensures that veterinary technicians maintain a high level of competence and are equipped with the most current knowledge to provide the best care for animals. The American Veterinary Medical Association (AVMA) and National Association of Veterinary Technicians in America (NAVTA) support continuing education by offering accredited programs, workshops, webinars, and conferences. Continuing education fosters the development of specialized skills, such as advanced imaging techniques or anesthesia management. Additionally, some regions require continuing education credits as part of the certification or licensure renewal process to ensure that professionals stay informed of evolving standards and best practices. What are the key factors a veterinary technician must consider when positioning an animal for a radiographic exam? Answer: the positioning of an animal for a radiographic exam is crucial to obtaining accurate images while minimizing stress and injury to the animal. Key factors include animal restraint, using appropriate techniques and equipment to secure the animal without causing harm or distress, while also ensuring the animal is still for accurate imaging. Correct alignment. The technician must ensure the animal is properly aligned with the X-ray beam and receptor to avoid distortion or incorrect images. Safety. Technicians must follow radiation safety protocols, including proper shielding for both themselves and others in the room. This includes the use of lead aprons, thyroid shields, and ensuring minimal exposure to radiation. Communication with the veterinary team. The technician should work closely with the veterinarian to understand the specific area to be imaged and ensure that the position maximizes diagnostic accuracy. How do the principles of CT, computed tomography, differ from those of MRI, magnetic resonance imaging, in veterinary diagnostics? Answer: CT and MRI are both advanced imaging techniques, but they operate on different principles and offer distinct advantages. CT uses X-rays to create cross-sectional images of the body, providing detailed information about bone structures, soft tissues, and organs. It is particularly useful for assessing fractures, bone abnormalities, and complex tissue structures. MRI, on the other hand, uses strong magnetic fields and radio waves to produce high-resolution images of soft tissues. It is superior for imaging the brain, spinal cord, muscles, and joints, as it does not rely on radiation. In terms of clinical applications, CT is typically faster, while MRI provides more detailed soft tissue imaging. Both technologies require specific safety protocols due to the equipment's complexity and the potential risks to both animal and technician. How should a veterinary technician interpret radiological images when diagnosing a suspected bone fracture versus a soft tissue injury? Answer: interpreting radiological images requires an understanding of radiological anatomy and pathology. When diagnosing bone fractures, the technician should look for visible disruptions in bone continuity, misalignments, and bone fragments in radiographic images. X-rays often clearly show fractures, and the technician should assess the extent and type. Simple compound comminuted of the break. For soft tissue injuries, radiographs may not always provide clear details, but they can show signs such as swelling, tissue displacement, or foreign bodies. For better soft tissue visualization, an MRI or ultrasound might be recommended. The technician must also consider radiographic positioning, exposure settings, and other factors to ensure the images are clear and diagnostically useful. What measures should a veterinary technician take to ensure radiation safety when working with diagnostic imaging equipment? Answer: radiation safety is critical in veterinary practice. Veterinary technicians must adhere to several key safety measures. Distance: technicians should maintain a safe distance from the radiation source whenever possible. Shielding: lead aprons, gloves, and thyroid shields should be worn by all personnel in the room, and a lead barrier or shield should be used between the technician and the X-ray beam during exposure. Time: minimizing exposure time is essential. Technicians should ensure that only the necessary amount of time is spent near the radiation source. Monitoring: regular monitoring of radiation exposure through dosimeters is essential to ensure that technicians do not exceed safe exposure limits as outlined by the National Council on Radiation Protection and Measurement (SEP). Explain the process of blood circulation in the heart of a dog. How do the systemic and pulmonary circulations differ, and what role does the heart play in regulating blood pressure? Answer: the circulatory system of a dog involves two main circuits: the systemic circulation and the pulmonary circulation. The systemic circulation delivers oxygenated blood from the left side of the heart to the body tissues, while the pulmonary circulation transports deoxygenated blood from the right side of the heart to the lungs for oxygenation. The heart functions as a pump to maintain this dual circulation. The left ventricle pumps oxygen-rich blood through the aorta into the systemic circulation, while the right ventricle pumps deoxygenated blood into the pulmonary artery for lung oxygenation. The regulation of blood pressure is primarily influenced by the heart's output and vascular resistance. According to the Frank-Starling law, an increase in venous return, preload, causes the heart to stretch, leading to a stronger contraction and a higher stroke volume, which raises the blood pressure. Key regulations and guidelines. The American College of Veterinary Internal Medicine (ACVIM) provides guidelines on diagnosing and managing cardiovascular diseases in dogs, which includes assessing blood pressure and heart rate to determine overall circulatory health. What are the key steps involved in performing a neurological exam on a dog, and how can reflex testing help in identifying neurological disorders? Answer: a neurological exam in dogs typically involves assessing the following components: mental status, check for any signs of confusion, disorientation, or altered behavior. Cranial nerve function, evaluate the function of each cranial nerve, testing responses such as pupil constriction and corneal reflexes. Posture and gait, assess for any abnormal posture or walking patterns that may indicate neuromuscular or vestibular disorders. Spinal reflexes, test reflexes such as the patellar reflex, knee-jerk, withdrawal reflex, and anal tone. These reflexes help assess the integrity of the spinal cord and peripheral nervous system. Sensory response, evaluate the dog's response to pain stimuli to check for any deficits in sensory function. Reflex testing provides vital information about the location of neurological dysfunction. For example, a lack of a patellar reflex may suggest damage to the femoral nerve or spinal cord at the lower level. Reflex testing also aids in distinguishing between central brain or spinal cord and peripheral nerve lesions. How does hypothyroidism manifest in dogs, and what diagnostic tests would you use to confirm the diagnosis? Answer: hypothyroidism is a common endocrine disorder in dogs where the thyroid gland fails to produce adequate amounts of thyroid hormones, and leading to a range of symptoms such as lethargy, weight gain, coat changes, and skin issues. It is most prevalent in middle-aged and older dogs, particularly in breeds like Golden Retrievers and Dobermans. To confirm hypothyroidism, several diagnostic tests are commonly used. Totaled and freed. Measure the concentration of thyroid hormones in the bloodstream. Low levels of T suggest hypothyroidism. TSH, thyroid stimulating hormone test. An elevated TSH level alongside low can help confirm hypothyroidism as the pituitary gland increases its output in response to low thyroid hormone levels. Thyroid antibody test. Some dogs with autoimmune thyroiditis may have antibodies against thyroid tissue, which can be detected by this test. Regulatory considerations. The American Animal Hospital Association (AHA) provides guidelines for diagnosing and treating hypothyroidism in dogs, emphasizing a comprehensive diagnostic approach. Dr. Smith is reviewing a lab report for a 4-year-old male Labrador Retriever. The report indicates increased AST, aspartate aminotransferase, and normal ALT, alanine aminotransferase. But what is the significance of this lab result, and how should Dr. Smith interpret these findings in the context of the dog's clinical presentation? Answer: AST, aspartate aminotransferase, is an enzyme found primarily in the liver, heart, and skeletal muscles. Increased AST levels without a corresponding increase in ALT, alanine aminotransferase, can indicate damage to tissues other than the liver, such as muscle injury or hemolysis. In contrast, a significant rise in ALT levels would point more directly to liver damage. Dr. Smith should consider the dog's clinical symptoms, e.g., lethargy, vomiting, muscle weakness, etc., to help narrow down the differential diagnosis. If the dog shows signs of muscle weakness or has recently engaged in strenuous activity, muscle injury may be the cause of elevated AST. However, if the dog has no such history, further testing, including muscle enzyme tests, e.g., CK, may be necessary. Key regulatory guidelines. The American College of Veterinary Pathologists Act provides guidelines on interpreting biochemical profiles in animals, which includes the context of enzyme elevation and clinical symptoms. Describe the key anatomical differences in the respiratory systems of cats and dogs and explain how these differences affect their clinical presentation in conditions like asthma. Answer: the respiratory system of cats differs from that of dogs in several ways. Airway structure: cats have more sensitive airways, making them more prone to airway constriction during an asthma attack. This is a species-specific feature, and their bronchioles are more easily obstructed. Respiratory rate and depth: cats typically have faster respiratory rates compared to dogs, and they may exhibit more pronounced signs of respiratory distress during asthma attacks, including open-mouth breathing and coughing. Asthma pathophysiology: in both cats and dogs, asthma involves inflammation and constriction of the airways, but cats tend to develop more severe bronchoconstriction due to their anatomical sensitivity. Treatment and management are tailored based on these differences. In cats, beta agonists and corticosteroids are often used to manage bronchoconstriction and inflammation, whereas dogs may respond better to inhaled therapies. A 7-year-old Dachshund presents with severe abdominal pain, vomiting, and a history of lethargy. The abdominal radiographs show distension of the small intestines. What are the potential diagnoses, and what additional diagnostic steps would you take to confirm the condition? Answer: the distension of the small intestines on radiographs suggests a potential intestinal obstruction. The differential diagnoses for this condition include foreign body obstruction. Ingestion of foreign objects can block the intestine. Intussusception: a condition where part of the intestine folds into another segment, causing obstruction. Volvulus: twisting of the intestine, leading to obstructed blood flow and potentially fatal consequences. Megacolon or ileus: reduced motility in the intestine. To confirm the diagnosis, further diagnostic tests such as ultrasonography or contrast radiography, e.g., barium swallow, are needed to identify the location and nature of the obstruction. Blood work would also help evaluate dehydration and electrolyte imbalances caused by the obstruction. Key regulations. The American College of Veterinary Surgeons Act. How do aging changes affect the musculoskeletal system in large breed dogs, and what preventive measures can be implemented to manage age-related musculoskeletal degeneration? Answer: as large breed dogs age, they often experience degeneration of the musculoskeletal system, including osteoarthritis or degeneration of the cartilage in joints, leading to pain, stiffness, and reduced mobility. Muscle atrophy: loss of muscle mass, particularly in the hind limbs, as the dog becomes less active. Degenerative disc disease: in some dogs, age-related changes in the intervertebral discs can lead to compression of spinal nerves. Preventive measures include weight management, ensuring the dog maintains an optimal body weight to reduce stress on joints. Joint supplements: administering glucosamine and chondroitin to support joint health. Exercise management: low-impact activities like swimming can help maintain muscle tone without stressing the joints. What does the term laparotomy mean in veterinary medicine, and when would it be indicated for a dog? Answer: a laparotomy is a surgical procedure involving an incision into the abdominal cavity. It is often performed for diagnostic or therapeutic purposes, such as exploratory surgery. When the cause of abdominal pain or other symptoms is unclear, a laparotomy allows direct visualization of abdominal organs. Foreign body removal: if a foreign object is suspected to be obstructing the digestive tract, a laparotomy may be necessary to remove it. Biopsy or tumor removal: A laparotomy is also used to take tissue samples for biopsy or remove masses in the abdominal cavity. Surgical guidelines. The American College of Veterinary Surgeons Act provides guidelines for performing laparotomy safely, emphasizing the importance of sterile technique and post-operative care to prevent infection. A 5-year-old mixed breed dog is undergoing surgery to repair a fractured femur. The veterinarian prescribes a combination of pre-anesthetic sedatives and opioid analgesics. Explain the pharmacological basis for using these medications and how they interact with the dog's body. Answer: pre-anesthetic sedatives, such as acetylmazine or dexmedetomidine, are used to calm the animal before anesthesia, reduce anxiety, and facilitate easier handling. They work by depressing the central nervous system (CNS) and promoting sedation. Opioid analgesics, such as morphine or hydromorphone, are used to manage pain. They work by binding to opioid receptors in the CNS, blocking the transmission of pain signals and inducing analgesia. Opioids can also have sedative effects and are often used to enhance the effects of general anesthetics. The combination of these drugs ensures both pain relief and sedation during the surgical procedure. However, opioids can also cause respiratory depression, so close monitoring of respiratory function is necessary. Clinical guidelines. The American College of Veterinary Anesthesia and Analgesia provides specific guidelines for the safe use of anesthetic agents and pain management in veterinary practice, including the use of sedatives and analgesics. 3-year-old Shih Tzu presents with pruritus, erythema, and alopecia, along with a history of recurrent ear infections. A skin scraping reveals the presence of Malassezia pachydermatous. What is the diagnosis and how should the condition be treated? Answer: the diagnosis is likely Malassezia dermatitis, a fungal infection caused by the yeast Malassezia pachydermatous. This yeast is a normal inhabitant of the skin but can overgrow under certain conditions, leading to infection. Common predisposing factors include allergies, hormonal imbalances, e.g., hypothyroidism or excessive moisture from ear infections. Treatment typically includes antifungal medications, topical antifungals like metronidazole or ketoconazole, or systemic medications if the infection is severe. Medicated shampoos containing chlorhexidine or selenium sulfide to control yeast growth and reduce pruritus, addressing underlying causes, treating any concurrent skin conditions such as allergies, or managing hypothyroidism to prevent recurrence. Guidelines. The American Academy of Veterinary Dermatology provides guidelines for diagnosing and treating fungal skin infections in animals, focusing on the importance of identifying underlying causes and preventing recurrence.